We had our grand opening of our cheetah exhibit at the Detroit Zoo, which was wonderful. But then in the next 3 days, all 3 of the cheetahs died. And it just so happened that the world expert was just up the road in Lansing.
Welcome to Dogtors Without Borders, the official podcast of the MSU College of Veterinary Medicine. I'm your host, Kristen Lair, and today we're stepping into the wild side of veterinary medicine. Joining me are Dr. Dalen Agnew, a boarded veterinary anatomic pathologist and zoo and wildlife specialist, and Dr. Ronan Eustace, a board-certified zoo and wildlife veterinarian. Let's jump in. Drs. Agnew and Eustace, welcome to the show.
Thanks.
Thank you.
So let me start off by asking each of you, what drew you to a career in veterinary medicine?
My parents were both family doctors in small town Saskatchewan, Canada. And so I was always around the hospital. When I was an undergrad, I started shadowing at human hospitals and also veterinary hospitals. And I felt that veterinary medicine was more akin to what my parents did. And so that's why I sort of got drawn towards veterinary medicine. I like the diversity. I like being able to do dentistry, anesthesia, surgery. I felt human medicine was a bit more specialized, and I just liked that role that the veterinarian had in the community.
Yeah, I grew up on a horse farm, and so I was. We showed quarter horses, and that's about it. I remember having rabbits vaguely, but we didn't have anything but horses. And then I worked on a farm, which was a kind of like a dude farm, where they had cows and sheep and draft horses, and I was a teamster there for quite a few years. And so I just always loved animals, and I always wanted it to be my hobby. And my real interest was Russian and Russian history and international politics. And so I was going to grow up and be a diplomat. So I'd seen all of the amazing stuff that was going on in world diplomacy at that time. And I wanted to be the next Henry Kissinger and be an international player. And then I noticed that he always wore a tie. And I said, I'm not going to wear a tie all my career. So I decided to swap things and make animals my career. And so after 2 years of undergraduate, I went to Michigan State University, did my poultry science and other requirements which were required at the time, and became a veterinarian. And that was how I got into veterinary school.
Well, I think we can make a good case that you're probably still a diplomat.
I try to be.
You can carry those skills with you everywhere.
Yeah.
So I should mention that Dr. Agnew is a faculty member with the College of Veterinary Medicine. He's also the chair of our pathobiology and diagnostic investigation department. And Dr. Eustace is also a faculty member and the lead veterinarian at the Potter Park Zoo in Lansing.
How did you get into zoo medicine?
I had done a lot of biology work and worked as a conservation biologist all through undergrad. And I had an interest in medicine. So it sort of was a bridge between the two, sort of being able to do conservation and also do medicine. So I was doing a bighorn sheep wolf job for Parks Canada in Rocky Mountain, and I was working with Todd Shurry, who's the Parks Canada wildlife vet, and I was helping him anesthetize and collar bighorn sheep, and I just liked what he was doing, and I thought it was very interesting, and so I went to the Wildlife Disease Association conference in Edmonton. I met my wife there, Dr. Kim Thompson, who is also faculty at Michigan State. She's at Binder Park Zoo, and her love is reproduction, particularly neonatal medicine and particularly hoofstock medicine. And she invited me to come to a zoo vet conference, and I went to that, and I actually thought the zoo vet conference was more interesting than the Wildlife Disease Association. So that's sort of how I sort of started thinking maybe I should become a zoo veterinarian, because zoo veterinarians you do clinical work, but you can also do research. And so that really appealed to me.
So did you get to jump out of helicopters? And
no, I didn't. Actually, one time I drove like 4 or 5 hours with a collar to bring it up to Nigel Coquette, who's a faculty at UFC or University of Calgary, veterinary medicine, and he's an anesthesiologist. And my boss at the time had said, oh, he'll probably take me on the helicopter. And so I drove. I was really excited, got there. He just took the collar and then headed off. So I was a bit disappointed, but I know him and he's very nice. He's a very good researcher, and there just wasn't enough room on the helicopter that day.
You didn't hold it against him?
No, I didn't hold it against him. And so
cool. But I was also ended up kind of falling into zoo medicine, maybe a little different. I was going to be a horse vet for the long time. So my career is a lot of I thought I was going to, and then I thought I was going to do this then. And I was going to be a horse vet. And in fact, I applied for horse vet jobs my senior year. And at the very last minute, I got a phone call from the Detroit Zoo saying that they needed me to come and apply and interview for a position at the Detroit Zoo because they had no applicants. Because at that time, the Detroit Zoo was having a rough time, and it was not a pretty place. They had a lot of severe budget problems, and Detroit was kind of on the skids at that time. And so I went and applied. I had actually done a short internship my very first summer, so they knew who I was. And I applied, and of course I was the only applicant, so surprise, surprise, I got the job. The rest is history. But anyway, I was at the Detroit Zoo, and I had a couple of opportunities to travel while I was at the Detroit Zoo. They had polar bear tours, and so I got to go up and see the polar bears up in I think it's in northern Ontario, is it? Or is it
Manitoba? Like
Manitoba?
Churchill?
Yeah, in Churchill.
Yeah.
Churchill's in Manitoba. And see the polar bears there and take a whole bunch of senior citizens there. That took some of the fun off of it, but it was still it was amazing to go up there.
Yeah. How did you transition into pathology? Like, why did you move from being a clinical zoo veterinarian, which for a lot of veterinarians is a goal, to then go and deal with the dead stuff?
Yeah, it's an interesting story, I guess, because I didn't really realize it until later, but I'd actually written a poem when I was in veterinary school about born to be a pathologist. So I must have known that I was going to be a pathologist, but I practiced medicine at the Detroit Zoo for 9 years. And there was 1 year, I think it was maybe 7 years in, so probably 98, that the Zoo Vet Conference was in Michigan State. And Linda Munson was a zoo pathologist and had been doing some amazing things. And she was particularly interested in cheetahs. And it so happened that weekend of the meeting, we had our grand opening of our cheetah exhibit at the Detroit Zoo, which was wonderful.'t then in the next 3 days, all 3 of the cheetahs died. And so I had to bag up the cheetahs. And it just so happened that the world expert was just up the road in Lansing. So I bagged them up and drove them up there every evening. I drove a different cheetah up there and talked to Linda and said, not sure what's going on here, but maybe you can help me out. And she said, you should do a pathology residency. And I realized that, you know what, some of my patients were going there. That's where the answers really are. And so it's important to treat them, but I kept finding out that I was treating stuff and I never really knew why it was getting better or why it died. And pathology is all about getting those answers. Sometimes those answers are a day too late, but you still hopefully can help the cheetahs of the future.
So what did you find out about the cheetahs?
Another interesting story, they have a disease called veno-occlusive disease, which is difficult to understand. We still don't know what caused it, but lots of cheetahs at that time, say from the early 90s to early 2000, were dying of veno-occlusive disease. And all 3 of these cheetahs died from veno-occlusive disease. So they probably all had it. And then the stress of the new exhibit and all of that just pushed them over the edge. So we still don't know what caused that disease. We just had a 30-year retrospective zoo and wildlife pathology conference at the last AAZV meeting. And that was one of the things that came up is like, we're still see occasional cases and nobody knows what causes it.
Does that involve blood vessels or blockage?
It involves, so the liver, for whatever reason, almost exclusively in the liver, the central vein, which allows the blood to drain out of the liver. So blood comes into the liver, it gets filtered, and then it drains out of the liver. And those central veins, which allow the blood out, become very, very fibrosis, very, very stiff and narrow, and they fill in with connective tissue. And so ultimately the livers swell up and become dysfunctional and the animals die. And we see it in humans with alcoholism. We see it in animals that have certain toxins. So pyrrolizidine alkaloids is a toxin that we see. So we see it in horses and cows. In fact, I still remember from my pathology board exam that there was a disease in a tiny island in the Western Pacific where horses would get veno-occlusive disease, and nobody knew why. So anyway, lots of nobody knows why, and we were hoping cheetahs were going to figure it out, but they never did.
So interestingly, you mentioned the connection between animal health and animal disease and the same type of disease in humans. So maybe you could talk just a little bit about the One Health aspect of your jobs, both of you, and explain a little bit to our listeners what One Health means, because that's a term that we all bandy about, but I don't think is widely understood.
It involves considering humans, animals, and the environment, like the earth and the air and the ground and the water, and considering them as one holistic organism that you need to keep healthy. And that the health of the animals impacts the health of the humans, and the health of the environment. Health of the environment impacts the health of humans and animals. And certainly humans impact the health of the environment and animals. And so taken together, you can kind of consider you can look at that from any angle, but from whichever angle, you need to consider that you're seeing the whole picture. Some people mistake that, I think, for what we call translational medicine, where we use animals as models for human disease, or as a veterinarian, I like to think of humans as models for animal disease, and we can learn things from that. And that's certainly true, and that's kind of a little part of One Health, but it's not the biggest part. The biggest part is that real holistic vision of how we're all intertwined, and our health is all we're all dependent on each other for our health.
Great. So, Dr. Eustace, how does that factor into what you do here?
Yeah, being a zoo clinician, the zoo is sort of a microcosm for a lot of different species, and they come into contact with many different humans. So there's a lot of, and wildlife, surrounding wildlife. So there's a lot of spillover of diseases into the zoo animals. And so we often are dealing with zoonotic pathogens. We'll be often the first people to detect them in the zoo because we do so much routine health exams, and all the animals at the zoo, when they pass away, get a full post-mortem with histopathologic evaluation. So we often diagnose things that maybe haven't been detected by other agencies. And so One Health is a big component. So whether it's the raccoons who are shedding leptospirosis, and then it's spilling over into the Patagonian cavies at the zoo, and they're getting sick, but it's a disease that can also cause illness in the human. So, or if it's rabies, more so on the East Coast, but we might have a rabid animal that comes in, interacts with the zoo animal, gets exposed, and then we'll trap the raccoon, send it out for testing, but there might be people who may have also encountered that potentially rabid animal. Right now, we're just starting a research project where we're evaluating antifungal resistance. So there's fungus that affect human and animals, and particularly penguins. The drugs that we use, there's similar compounds that are used to treat crops and treat aspergillosis in crops. That's sort of promoting resistance, and then we're seeing resistant strains go into humans and animals. So we're looking at it in penguins right now. It hasn't really been evaluated very much in the US. It's been evaluated a lot in Europe. And when a person gets infected with this fungus, a resistant strain of that fungus, it's very difficult to treat. So the mortality is much higher. So it is a real significant issue. And so we are looking at it to treat penguins, but we're also trying to see how much resistance is in this strain of fungus or strains of fungus as in the background. It's useful information, not just from the penguin perspective, but from the human perspective as well. And so that's one of the fun things about zoo medicine is there's often a lot of stuff we don't know. So there's often a need to do research so we can figure these things out so we can do the best medicine possible. Not just treating the individual, but then trying to help treat the whole population, which is what you do a lot of, right? You're really a population doctor at your level, I would say, right?
In pathology, we're looking at one case, hoping to extrapolate to all of the animals in that population and learn something about that. That's true. Yeah.
But and your reproductive work, your reproductive work is instrumental to making populations sustainable.
Yep. Yeah. So that's my research area. So I diagnose wildlife diseases, but my particular area of interest is in reproductive diseases of wild animals. And so nothing talks about the survivability of a species like reproduction. If they can't reproduce, the species is going to die out. So we try and do a lot of really valuable stuff there. And I think, we look at great apes. We've got projects in great apes now, and we've got projects in lions and tigers and looking at elephants. And we're working with colleagues who are working with stingrays and stingray reproduction, which is really interesting. And interestingly, we use contraceptives frequently in our wildlife in order to not so much stop them from breeding, but to control when they breed so that we can manage the space in the zoos and to manage the genetics so that certain animals are not overrepresented in the genetic pool. And so we use a lot of contraceptives, and one of the things that we're trying to do is to make sure those contraceptives don't damage the fertility of the animals. And so retrospectively looking at reproductive tracts from animals that die is an important way to do that.
So I'm curious, how does one deliver contraceptives to wildlife? Is it an implant? Is it in their food?
Yeah, there's different ways to do it. It depends on the animal. So some, like hoofstock, we might do it in the food. The challenge when we're feeding them is that we have to make sure they're taking it, and sometimes they don't take it. Usually, if we can do it as an injection or an implant, that's often the route we often go with because we usually feel more confident with it. So we often will place different implants, whether it's a progesterone-based or a GnRH agonist. Those are the most commonly used ones. There are some novel things like GnRH vaccines that are being investigated that are very useful. And then there's always surgical methods. But even the implants have their risks. Certain monkeys will pick them out, and then you think you've contracepted them, and then the animal starts looking heavier and more swollen. I've got a lemur like that I've got to go ultrasound, who I think may have picked out her implant. So nothing is perfect.
In the maternal way.
Yeah. Yep. So it's, and one of the big challenges is we're working on so many different species. So a lot of our dosing is anecdotal. It's based on a lot of anecdotes. Like we have a system for recording, but it's still anecdotal. So some of the research that Dr. Dalen does has been sort of trying to figure out effective doses. And we've participated in some of those studies and for some of the newer contraceptives. And it's really important information because, again, being able to control contraception really allows us to manage the populations effectively with limited space. And again, we really want to make sure that what we're using is safe for the animal, but also reversible. So, and that's the real challenge, the reversibility. Sometimes we'll put something in and it takes a very long time for that animal to breed. And then we can miss a window for when they have the window to breed. And it's challenging. Zoos are a lot of different moving parts, many different zoos participating. So,
lots of different personalities and priorities in the zoo world as well. So it's like having many clients.
Yeah.
Yep. Every animal, that's the problem, I think, in the zoo is that if you are working on a zoo animal, you've got the curator and the director and the zookeeper and maybe 3 or 4 zookeepers that love that animal. But you also have 100,000 people in the greater Lansing area who love that animal. And so the pressure and all of those people are standing around you, figuratively in the exam room when you're doing work. So it's not an easy job to be a zoo veterinarian for sure.
It's a fun job though.
It is a fun job.
It is a lot of fun. It is a lot of fun. And if you like research and you like diversity, there's no shortage of opportunities to do research. And some of the great things too is that we can do research on zoo animals that we really can't do on wildlife. So we can do studies in zoos that we just couldn't do with wild populations. So we can get information that then can be used for wild populations, which is very exciting. My wife has been looking at different pain medications and antibiotics in giraffe, which is useful for the captive population, but for when giraffe are injured in the wild with snare injuries, it's very useful for a wildlife veterinarian to know what's the right dose of antibiotic or pain medication. And you couldn't do that study on wild giraffe. You can't get a population of giraffe who are going to be trained to let you do repeated blood draws to measure drugs to figure out what the right dose. So that's really exciting when we can do that. When we can do studies that not just help the captive population, but help wild populations, that's our favorite thing to do.
Can you describe a particularly memorable or meaningful case that reflects the complexity or reward of this kind of veterinary work?
At my last institution, we had Amur leopards, which are critically endangered. There's less than hundreds of them left in the wild. And we had I had a cat named Novi, who was a very challenging case. The animal had developed like hypovitaminosis D and then started developing pathologic fractures, which is unusual. It had, and the reason it developed hypovitaminosis D, so low vitamin D levels, was that the animal had developed inflammatory bowel disease. And I came in one morning, and in the cat building, there was 6 big cats, and they were all vomiting and having bloody diarrhea. So it wasn't a good day. I was pretty bummed about it. So she was the worst. So I ended up anesthetizing her, and on x-rays and physical exam and ultrasound, it looked like she had a small bowel obstruction. So I was lucky. I reached out to MSU College of Veterinary Medicine, and one of the faculty who's no longer there came out and helped do surgery. We did surgery. There was no obstruction. There was just a big loop of necrotic bowel that we had to remove. Submitted it for histopath. Came back as eosinophilic enteritis, which is an unusual diagnosis, especially in an Amur leopard. I did a lot of testing trying to find an etiologic agent. Didn't find anything. And honestly, I didn't believe it had IBD because it was 5-6 cats, all with similar clinical signs. I thought there was an infectious agent, and I just didn't find it. So we did PCR, fecals, cultures, just didn't find it. But then the cat, I think it was a year later, presented again while I was away with bloody diarrhea and also a fracture, which was weird. So when we did the exam, we ended up re-scoping the cat later once we had more stable, confirmed the diagnosis, and then we also had these pathologic fractures that were occurring. And so at that time, I hadn't learned about the association between infiltrative diseases in the intestine and hypovitaminosis D. There was just some publications starting about it from Edinburgh's School of Veterinary Medicine. There was a few researchers, and so it was a very challenging case. Again, there's very few of these animals. Each individual is critically important. So we ended up doing exams every other day for about 20 days. And I had to order in vitamin D from India because India, for whatever reason, has a high amount of low vitamin D in their population, trying to figure out the dose to treat this animal to try to get its vitamin D level adequate so it wouldn't keep having pathologic fractures. At the same time, we had to fix the fracture. The fracture became infected. It was a very challenging case, but eventually the animal did recover, and we got the IBD under control. We got the pathologic fractures under control, and save the animal's life, which was, again, important. But it was a very challenging case. And I was very lucky because I worked with many specialists from Michigan State, and I was a couple hours away, and they were all willing to come and help me, whether it was the surgeons, small animal internal medicine came out and helped with the scoping. The pathologist helped me with looking at the biopsies. And again, it was an unusual diagnosis. Endocrinology helped with the vitamin D measurements, and we ran multiple samples from other individuals because we had no normals. So it was very challenging. Talked to internal medicine many times on that case. So it was a good learning experience. But again, when we're dealing with these critically endangered animals where there's only hundreds of them left in the world, each individual is so important. So it was a good case, but it was hard. I remember I was in Canada visiting my family. I got the call about this animal. I drove through the night through a blizzard because I was in British Columbia and Fernie at a ski town. So it was
in the winter,
got there, flew home, basically went in that night. We did the exam at 1 o'clock in the morning till 6 o'clock. The cat was profoundly hyperthermic, very shocky, thought it wasn't going to make it, but it did. Again, our patients are very tough. That's one of the nice things about zoo medicine. And then again, we just did exams every other day for many, many days. And I thought about writing up the case, but it's such a messy case because it's so convoluted. I still have the records up there, and I still think about it, at least doing one portion of it, because it is interesting, and there's not a lot of literature in Amur leopards. There's only a handful of papers, but that was a good learning experience. And yeah.
I had worked at Detroit Zoo with their elephants, and in fact, they had a concern about tuberculosis. And tuberculosis, human tuberculosis, is a big problem in elephants, that they catch it from humans. So back to One Health, they catch it from humans, and it can be very dangerous in elephants. And so we had tuberculosis in a black rhinoceros, and we were concerned about it in the elephants. We did testing in the elephants and found one of them was positive, but it's we now know so much more than I did. This is now almost 30 years ago, about tuberculosis and testing in elephants, that at that time there was no good test. And so in the process of trying to get good samples, unfortunately, the elephant died from the anesthesia. And it turned out that she had a damaged heart, probably from a previous infection of encephalomyocarditis virus, which is also a human pathogen, One Health. In the process of doing the postmortem examination on that elephant, I met one of my best friends, who was Hezi Shoshani, who was a scientist who loved and was passionate about elephants. And so Hezi and I became great friends, and he made me dedicated to science as a part of what I was doing, not just medicine, but science. And so anytime I had any elephant activity, turned out he had a pet hyrax, and hyrax are the nearest relative to elephants that there are on the planet. So if you Google hyrax, and you'll see, I can't describe one because they don't look like elephants.
Are they large animals?
No, they're about like big rabbit sized. But if you look at the carpus, the arrangement of the bones in the carpus, the scientists tell me, is what links them to elephants, that they are the only two species that actually have all of the bones in the carpus are stacked. If you look at the carpus in other species, they're all kind of interlocking, but in elephants and in hyrax, they're stacked. And so they believe that there is a link between them.
So is a hyrax a pachyderm?
They're not. They're not.
Okay.
Hyraceae. But they are, if you look at the evolutionary tree, they are the closest living relative to elephants. And he wanted one because he couldn't keep an elephant in his condominium. So he had a hyrax. But anyway, so we studied hyrax together. We studied elephants. And to this day, I'm still really dedicated to elephants and the interactions of elephants. So it's taken me to Myanmar. It's taken me to India, taken me to Nepal. I've done postmortem examinations as a pathologist now, all over the United States, on elephants. And so I've gotten expertise, but also a passion for elephants. And so, and we're still, tuberculosis is a big issue with elephants, but we have so many more tools now. So it's really, it's kind of cool. But that first case really lit the fire for me for a particular species that I've stayed involved in to this day.
So I'm going to shift the topic just a little bit. We know that veterinary careers in zoo and wildlife medicine are competitive now and often nonlinear. So what advice would you give to students or early career veterinarians who are interested in pursuing this path?
Yeah, try to get animal experience early on. I think all animal experience is good, not just small, but large. The skills you learn working on cows, pigs, horses, that translates to when you're working on zoo animals. Getting in experience in zoos is hard when you're an undergrad or high school student, but there are some opportunities to work with animal care, so those are valuable to do. When you're in veterinary school, try to work and do a summer research project in your first or second year and try and get a first author publication, or just participate in research. Publications are really important. Join every club, I think, personally, in vet school, because you might be working on chickens, you might be working on goats, pigs, pathology. We do emergency medicine, it all crosses over. So I joined all the clubs. You can get something from every club. Be curious. about everything you can be. And so it's not just going to school, but it's your job. So try to focus when you're in school with that perspective, that this is your life career. And then in third and fourth year, be pretty systematic with choosing your external rotations. Try and choose places that have training programs so you can meet the people, go to the conferences. But that's what I would say. It's very, very competitive now. It's much more competitive. We have a training program, and the people that we get usually have graduated vet school, done 2 years of postdoctoral training, and then come to us for an additional year before they do a residency, if they get a residency. So it's very, very competitive. And most of the people we have multiple publications. Our next fellow has 10 first author publications and about 10 co-authorships. So that's fairly unheard of, but and she did not match with a residency, and she is, so it's very competitive, but the only thing you can do is just work hard and trying to do some research, because this field research is really important, because so much of what we do is novel, and the only way the field grows is if we can disseminate that information in scientific publications and share it.
I would agree completely with all of that. I would add a couple of things. One is that when I did my clerkships, I think it's important to get some zoo and wildlife experience and understand the zoo environment. But probably the two most important clerkships I took was emergency medicine and production medicine. So learning how to deal with herds, like vaccination, population health, is really important. And then most of the time, zoo animals hide their disease until the very last minute, and they're just about to die, and you've got to intervene, and that's emergency medicine. And so it seems like you go from, okay, I can't touch anything, to, okay, now I've got to touch everything and fix everything right now in the middle of the night while the heart is stopping, kind of a thing. So it's a kind of a dichotomy that way. The other thing I would say that is really important, and it's important everywhere, but I think very much so, is that you've got to be a nice person. Yeah. You've got to be a team player. You're going to have to self-advocate. You're going to have to say, I'm the one you want in this residency. I'm the one you want for this research project. I'm the one you want for this summer. But you got to do it in a nice way. You got to know how to talk to people, how to work in a team. You've got to, give credit to your teammates. And those are all people skills, which are incredibly important to your success once you're a zoo veterinarian, but also really incredible to you getting into that role. We've got a lot of choices. And if you come across as, brash and difficult to work with, we don't have time to work with that kind of personality in a competitive environment like that. So you really need to be aware of the soft skills as well. And that's really important.
Yeah, I would echo that. Like, I always tell students to make sure they stay humble, always say thank you. Like, we're happy to have students, but, it is, when people take students on, there's a little bit of extra work. And so for when you're visiting another zoo, being helpful, helping clean up, sweep, be friendly, say thank you, make sure people know that you're happy that you're there and that it's a unique opportunity. Little things like that play a big role in this field. I completely agree with Dr. Agnew. Like, it's a small field. And again, it's not always the smartest veterinarian who gets these jobs. I mean, we work with keepers and we basically live with our clients. Like, we see our clients, we have to have positive working relationships, because our keepers are the ones at the zoo who know the animals. They know when they're off. They don't know what's wrong with them, but they know something's off. And they're the ones who can get the animal to shift so you can evaluate it. They're the people who will get the animal to take the medication that you prescribe. Like, a lot of the animals see me and their hackles go up. They're mad at me because almost a lot of my interactions are negative. I'm anesthetizing the animal. I try to do as much as possible, try and build positive relationships, but the keepers are integral. And so as a zoo veterinarian, you have to be able to work with all these different personality types, and you have to really maintain relationships. And that's really soft skills. It's not always the smartest veterinarian who persists in the field. There were a lot of zoo veterinarians who were really type A for a while there, who would get in, be super smart, but then they wouldn't be able to work in a zoo setting because they just didn't have the right personality. You have to be able to joke. You have to be able to like we did a lion, and I'm lifting the lion, I'm sweating, like I'm getting in there, I'm helping move. You have to do that sort of stuff. You have to be a team player.
If you could go back and tell your pre-vet school self one thing about this journey, not just the job, but the life, what would you say?
I would say it's going to be a wild ride and it's fun. So don't set too high or too low of expectations for yourself, because and just make sure that you are present and enjoy it, because it'll be a great ride. Treat the people you're with on the ride well, and they'll treat you well.
Yeah, I mean, I guess I'd echo those sentiments. I definitely didn't know where I was. Like I had visions of a bigger zoo, but you never know where you're going to be and what's going to make you happy. And so I think things change, and everyone has expectations and then you see things and you realize, oh wait, the grass isn't always greener in certain situations. And so everything has pros and cons. That's what I've learned. So
I do have one last question for Ronan, to complete the statement that you brought up about elephants are a particular interest. What is your favorite animal to treat or work with?
I like black rhinos a lot, because we have a really great black rhino here, Dopsy. But I honestly, like, again, I love animals. Like every veterinarian loves animals. I particularly love coonhounds. I think they're a great breed, and they're, you go to the shelters in Kentucky and there's just tons of them being dumped in there, and they're a wonderful dog. I'm a huge fan of coonhounds. But I always liked the medicine. Like I'm not as much about the species, it's the case. But at the same time, I like that I'm doing conservation, but I'm not really like just one animal. It's more like the individual and then the case, the problem. That's what I always really get excited about, and the learning. So I don't really have I like rhinos. I like amphibians. I like this, but I don't have something that's just my favorite. My wife, she loves giraffe. Like she was a giraffe keeper. She loves giraffe. I'm more like, is it endangered? Do we need to help it? And then if it has interesting problems, that's what really gets me.
When I was at Detroit, I worked on Partula snails.
Yeah.
And it was interesting. I don't know, maybe 2 or 3 years ago, I saw a paper come out where they collected the data from the Partula snails that I had worked with 25 years earlier, all the way up to the current. They'd looked at mortality trends in Partula snails. And so I would say snails to elephants.
Snails to elephants. All right.
Yeah.
That wraps up our conversation with Dr. Dalen Agnew and Dr. Ronan Eustace. From pathology to patient care and some of the most unique species on the planet, their insights remind us just how wide-ranging and impactful veterinary care can be. If you enjoyed this episode, be sure to follow and share, and don't forget to stay connected with the MSU College of Veterinary Medicine for more stories from the front lines of animal health, science, and discovery. Thanks for listening, and we'll catch you next time on Doctors Without Borders.